Hey, Chris, it is very good to see you. And it's that time of year, Medicare open enrollment. We're going to talk about that and planning for healthcare in retirement. In retirement, your biggest expense is almost always healthcare, right? And we just want everybody to know, get your calendars and your pens out. Open enrollment dates, October 15th through December 7th. Chris, do you have any guidance for someone who's now 65 and qualifies for Medicare?
Yeah, absolutely. Medicare is such a huge part of a retirement plan. We actually have a partner here at Integrated Financial that handles solely Medicare. And as people approach that 65, that wonderful age of 65, a couple things to consider. One is all the parts to Medicare. There's Medicare Part A, Part B, there's something called Part C, and then Part D. And the first thing you want to make sure you do when you turn 65 is sign up for Medicare Part A. Even if you're employed, even if you have health coverage through your employer, Medicare Part A, you want to make sure you sign up for. If you don't, there's some penalties extra involved, and it could cause some challenges later down the road. So,
Mhm.
employed or not, make sure you sign up for Medicare Part A. And then if you are employed, you still have coverage, qualifying coverage through your employer, and you're fine. But if you're not employed, if you're retired, that's when you want to start looking at Medicare Part B and maybe even a Medicare supplement.
All right. So, one question that I'm sure you get from clients a lot, what if my spouse qualifies for Medicare and I don't?
Well, that's one of those unique things. With our health and coverage through our employer, often our spouse can come under that qualifying coverage through our employer. Unfortunately, not so with Medicare.
Mhm.
Medicare is for each individual. So if you qualify for Medicare and you're retired, you're looking at Medicare Part B, maybe a supplement, of course. We have to mention Medicare Part D, the drug plan. Your spouse still has to find qualifying coverage. If they're employed, that's fantastic. If they're not, that qualifying coverage will likely look like something through a state exchange.
Okay. Now, I'm sure you've heard about the great resignation, right, Chris? So let's say that I want to retire early at age 60, but again, Medicare doesn't kick in until 65. What do I do for those 5 gap years?
Yeah, that's notorious donut hole. That's a donut no one wants to take a
No.
bite of, unfortunately. But that donut hole, the time between you retire and qualify for Medicare, well, there's a possibility when you leave service that you may be able to have COBRA coverage through your employer. If you're downsized, that's very often the case, having coverage through your employer via COBRA. But if not, then again, we find ourselves looking for qualifying coverage through some other source. And again, most likely a state exchange or a private healthcare insurance.
Okay. Now, speaking of like choosing your healthcare plan, I know a lot of high deductible plans offer an HSA, a health savings account. And that's something you say we should all maybe consider.
Absolutely. You have a triple tax benefit with a healthcare savings account. They're not appropriate for every picture. And Erin, as you mentioned, it comes alongside a high deductible plan. With a healthcare savings account, you're able to set aside dollars pre tax. That has the benefit of lowering your earned income in that particular tax year. Then, when further down the road, you can access those dollars for qualifying health incidences tax free. And in the interim, that money grows tax deferred. You have various investment accounts that can actually augment that growth. That those dollars will be provided for you later down the road. Healthcare savings accounts are very flexible, they're very powerful, and certainly something to take a look at to see if it might work for your picture.
Yeah, sounds very attractive to me. Well, what I'm learning here, Chris, is that, Medicare has a lot of options and having that conversation early is probably best for everybody. So if somebody has any questions, Chris, what's the best way to get a hold of you?
Well, here at Integrated Financial, you can give us a call at 509-467-5117. Val Turcha is our partner here that handles all things Medicare, and certainly getting on her calendar early would be a benefit. That's 509-467-5117, or you can also visit our website, myifsteam.com.
All right, Chris, thank you very much.
Absolutely, Aaron. Wonderful to talk with you.